Solom Collier to join us. And let me introduce her and say one or two things about her. So Solom Collier is our today's speaker. She's a remarkable woman, like I said, whose journey resilience and impact continue to transform lives across communities and beyond. I call her a global voice of change. She's a breast cancer survivor, like you know, a global cancer advocate, um, an author. Can you please mute yourself, please? She's a community builder and she's passionate. She's passionate champion for health awareness. So through her work and advocacy, she has dedicated her life to educating women about the importance of early detection, health awareness, and cancer prevention. She is on a powerful mission to crush cancer through education, advocacy, and community engagement, ensuring that more women have access to life-saving information and support. Her influence has extended across Africa, particularly in Nigeria, where she has used her voice and platform to raise awareness, challenge stigma, support individuals and family affected by cancer, and inspire countless women to prioritize their health. Through her NGO, which is Solom Collier Breast Cancer Foundation, she has done supported various initiatives. She continues to create lasting impact, empowering women with knowledge, giving hope to those who don't even believe there's hope anymore, and navigating their own cancer journeys. She's a true voice of change and a beacon of hope to many, a living testament that challenges can be transformed into purpose and impact. Please join me this evening in welcoming the woman of change, Sam Collier. Thank you. Welcome. Over to you.
Thank you. Thank you so much. Thank you. I really appreciate that. Sometimes when they call me to come and, sometimes when you're passionate about something, also become nervous. Not to say the wrong things, but kind of to say the right things. And I call her Arewa. So like she said, we've been talking about this for months, and unfortunately we lost one of us, which she has just explained. Some of you here would know her because we've done one or two Instagram live with her. I'm sure Shola knows her. Unfortunately, we lost her. And like I always say to people, when people pass away, let's not say cancer killed that person. It was the person's time to go. It's not cancer. And that's my belief. It might be different for somebody else. So I'm not going to go on to, I've already been introduced, but I'm very passionate about calling, I am a stage 3 breast cancer survivor. I like to stress that. And I'll tell you why I like to stress it. My journey started in 2018 when I was having a shower and I saw a lump. I felt a lump. And did I do anything? I would say no, I didn't do anything. Because at the time, I'll be very honest, I hear about cancer, but I'll say I hear what is called cancer, but I didn't know what cancer was. And I was getting ready to go away on a girls' trip, and that was the most important thing to me. While I was away on the girls' trip, this was March 2018. While I was away on the girls' trip, I said to the ladies I was with, I've seen something on my breast, and one of my friends, she pressed it and felt, I said, this lump is big, oh. Then I said, yes, now it's big, but it's nothing. Then everybody started checking started checking themselves to see if there was something abnormal. But apparently, I was the only one with that kind of abnormality. So when we got back from the holiday, luckily, and I say that again, luckily, don't play with your health. Luckily, I got a letter from my GP to come and do what is called a smear test, which they do for us over here in the UK every 3 years. And that was my saving grace. If I did not get that letter, I might not, I might not be here today. So when I got that letter, I called the GP because that one is obviously, we know about it. Or once you get that letter, you want to go and do the test and make sure that you're okay. So when I got that letter, I went straight, I called the surgery and they booked me for an appointment to come in. But before the nurse could drop the phone, I said, "Oh, I just need to inform you, I found a lump on my breast." And she said, "Which part?" I told her the left side. And she said I should hold on. She spoke to the doctor, and the doctor asked me to come in. And like I said, that was my healing point because I went in, I was referred to do a mammogram. I went in for a mammogram, very nonchalant. Most of us are like that. I was very nonchalant about it. I was even telling them, please, you people hurry up. I need to go back to work. Without even knowing that there was a time bomb ticking. And when I did the mammogram, and 24th of May is a remarkable day for me every single year since 2018. That was the day the bombshell was dropped. You've got stage 3 breast cancer, and it is the aggressive one. And the first thing I said to the doctor there and then, I need the breast cut off. I wasn't thinking about any other thing. The only person I could think about at that time was my son. Nothing else meant anything to me. But my son was the only thing I could hold on to. And I said to the doctor, was like, "Oh, I haven't told you what it is, what stage it is, da 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 da." I said, "I don't really care. Cut the breast off." As if they were going to cut it there and then. Now, why am I telling this story? Some people might not be as lucky as I've been. And there are breast cancer, as we know, is the most common type of cancer worldwide, both in the UK, in Nigeria, in America, where one out of 10 women is diagnosed every single day. That's too much. One is more than it. One is a lot. And obviously, the most common symptom you can find when it comes to cancer is lump. And I would say people are lucky to find the lump because the silent ones are the ones that people don't see or feel. Before you know it, it has, kind of escalated. I'm using that word escalated. So you have sometimes the change of color in the breasts. You possibly might have rashes. You might see one or two rashes and you think it's nothing. And maybe you pop it. And when you pop it, it's not going. I've seen some women or heard some women, not seen physically, heard some women who have gone to, they will put palm oil and salt and rub on it. And you're looking at the thing, it's expanding, it's getting worse. You're not getting any better. Some people will say, "Oh, people from my village are chasing me." I don't know who is chasing you from the village. If you've offended anybody, that's when they will chase you. The law says, "He who comes to equity must come with clean hands." And if your hands are clean, I don't see why anybody should even get, anywhere close to you. As long as you and God are in the right terms, there's no need for somebody to be chasing you and to be able to get you. So you see, sometimes you would have unusual discharge from the nipple. And especially if you're not a lactating, if you're not breastfeeding, and you start seeing those kind of things. These are signs, they are trigger signs that you should go and speak to a doctor, not going to a chemist or maybe saying, "Okay, let me do home first aid." You might do home first aid 2 or 3 days and it doesn't work. If it doesn't work, by all means, please go and see a doctor. I know so many people say, I've come across a few friends who say, what I don't know will not kill me. But let me bust your bubbles. What you don't know is exactly what will kill you. Because the Bible says, my people perish for lack of knowledge. And when you don't know, you will definitely get your hands, your fingers, you will definitely get your fingers burnt. So, but if you know, like I found out, even though I didn't do something immediately, but I didn't delay it that much. I didn't delay it. So we must be conscious of our body, not just under the armpits, your neck, your collarbones, you back of your neck. If you see any change, when you're, in fact, be examining your body, like, you're massaging it, you're looking at it, be interested in your body. The body is yours to look at. And once the texture of your skin changes around the breast, don't say, okay, maybe, especially when you have to look at this is after, if you're still going through period, it's after you've gone through your period, then that's when you get kind of a better result of it. But if you're doing it whilst you're seeing your period, you might not see because of the hormonal changes that happens. But if you're not, you have to kind of look at yourself. Stand in front of the mirror. Stand in front of the mirror and look at yourself very well. When you look at yourself and you think, come on, there's something not right, oh. There's something not right. What should I do? Then that is the time to go and seek medical advice. You might go there, the doctors will look at it and say there's nothing. Now, I'm going to address most people, even people in the UK. Sometimes we'll go to the GP, they'll say, oh no, it's just a boil. Please don't ignore it. Do not ignore it. Keep an eye on it. If they say it's just a boil, give it another 2 days. If a boil would always reduce, but if it's not reducing, please go back. Go back and keep shouting until you get help. Because most of the time, those lumps turn out to be cancerous without us knowing. And by the time they're looking at it, they're telling us, oh, it's stage 3. Oh, the woman did not present early. But the person had come to you earlier and you've told them is a boil. What else do you want that person to do? And some women are very careless. Once it happens, they go to the village, they get a leaf and crush it and put it there. If I show you the pictures I have now for 3 women, I've got 3 women who they've reached out to me. I said to them, sorry, there's not really not, I'm not a doctor. There's nothing I can do. The more you leave it, the more fungated it becomes. And when it's fungated, it means that the cancer is actually metastatic to somewhere. And that's what we don't want. What we want to understand is when we see something, we are actually, looking at it, dealing with it, what do you call it? Dealing with it outright. And obviously, people say there are different, there are many different factors that can affect changes of developing breasts when we talk about that. It's a combination of things, our lifestyle, something called the genes. So there are some families that have got cancerous genes, and it's very important that if someone like me now that I've gone through cancer, I would always advise anybody from my lineage to go and check themselves. And there's something called BRCA test, and that's it's It's just a function, it's a primary function to check your genetics. If you've got, if in the within the family, if there's traces of cancer within the family, it will tell you. So if you do a BRCA test, a BRCA genetic testing, you can opt for it. If you've got daughters, I say to people who have got grown daughters, someone like me that I've come from, it's happened to me. At least I've got a sister, I've got nieces. They would have to go and do what is called a BRCA test just to know if it runs in the family. And it's very important that most people do that. And that was how Angelina Jolie actually found out that when her mother was diagnosed with cancer, she actually did what is called a BRCA test, and she found out that there are traces of cancer within the family. And she did bilateral mastectomy. She didn't have cancer, but she just had to do that, just to prevent if anything would happen. Nobody knows what will happen. Nobody knows who's going to get cancer or not. And what else can I say? Whilst I'm talking, please, if you have any questions, please by all means ask me, because I don't, I'm just talking about my own experience, my own journey, and all that, and the little knowledge I have about cancer and the people and the cases I've seen. I've been privileged to sit with doctors, like somebody like Dr. Molala Salako in her clinic, and to be able to learn a lot from oncologists. And it's very important. It's very important. And some of the things that are outside our control. There are 99% of new cases of breast cancer in women. 99% is a high number. It's a high number every single day. And as people get older, you now find out that even the younger women from 30, 20, they're now getting breast cancer. Before, they will tell you it's a white man's disease. There's nothing like white man disease. There is nothing. It's not a white. The only thing is, it's just now that I call myself a Gen Z. It's just now that we, the Gen Zs, have started speaking up, that people have now started to identify what is called cancer. Because in the past, people do not associate themselves when it comes to cancer. So many people have died from, so many people who have gone through cancer have passed on in the 80s. But because obviously they won't come out to tell you it's cancer, because nobody wants that stigmatization within the family. But now, people are no longer ashamed to come out and say, I've gone through cancer. Cancer is just one of the illnesses. There's diabetes, there's kidney, there's a lot, there's HIV. So why would cancer survivors and people who go through cancer go through pain? Because they've been diagnosed with cancer. No. And that's one of the things people don't want to speak up. People don't want to come out to say that that they've got this. And I remember when I was going through my treatment, I kept it within a very small bubble. And the reason why I did that was I did not want a situation where somebody would come and be asking me, stage what did the doctor say? Did you know Mr. Okeke died of cancer? Did you know this person died of cancer? I wanted to keep focus, go through my treatment, then come out and let people see. You go through the fire, come out refined, and people won't believe you've gone through it. At the end of the day, I have somebody that will say, oh, somebody actually called me and was saying, what do you think? Should I cut my breast or should I not cut my breast? Because she's been diagnosed with stage 2. And I said, what did your doctor say? Oh, the doctor advised that she takes it off. And they found a lump on the second breast. So I asked her, if you die today, where would the breast go? Because I can be very brutal with my questions. I don't really, if you die today, God forbid, where would those 2 breasts go? She said, they will bury me with it. I said, then, would you prefer to go now or go maybe 50 years later when you're 90 without the breast, or go now with the breast? Which one do you prefer? I said, go to bed, think about it, and let the decision be yours. I can't be deciding for you because I took my decision when my own case came up, and I took the decision instantly because I want to live. I want to enjoy life. I want to see my son marry. I want to carry grandchildren. So at the end of the day, cancer is not really what anybody should toy with. It's not. It's something we should take very seriously. And we should not be ashamed of going through the journey. We shouldn't. Um, Around 55,000 women are diagnosed in the UK every year with breast cancer. 55,000 is a lot compared to the male counterpart of 400 in the UK. Unfortunately, Nigeria do not have statistics of cancer, people going through breast cancer, more or less cancer survivors. They do not have no statistics of that. We've been trying to make sure that we get the statistics, in terms of demographic statistics and all that, to get the statistics to see what is the survival rate of cancer. And there's really been a good survival rate now that the treatment has been modified. And again, good survival rate if caught on time, not when it's metastatic. Because by the time it's metastatic, maybe it's gone to the lungs, maybe it's gone to the brain, maybe it's gone to the kidney, or even the spine. Now, don't forget that when it travels all around, they're not only dealing with one side of your body, they're going to be dealing with different parts. And um, it becomes painful, it becomes disturbing, it becomes expensive, it becomes time consuming, and you become confused. Even some of us that have gone through this journey, they've just told us, okay, it's breast cancer. I'll be very honest with you. People don't look at me like superwoman, no. And now when I finish talking to you people, now these ladies on this platform from Giggles and Grace, people go and use it against me. You people know what will happen. There's some days like today, I'll be very honest. Today I've been very moody. I've I've been I was speaking to a friend of mine in the States, and I said to him, I'm not liking today. And he was like, what's wrong? I said, I can't place my hand on what is wrong, but I know that I'm not happy. And he said, and I said, okay, maybe because today is Cancer Survivors Day. He now asked me, are you not happy to be alive? I said, I'm 100% happy to be alive. But, there's something that comes with, sometimes your mind is, playing some mind games. You have a headache. You're thinking, is it cancer? Has it come back? So that's why I keep myself occupied. I keep myself busy. 1 minute, please. Sorry. So I keep myself occupied. I
You
keep
raise
my
your hands if you have questions, or you put it in the chat. Thank you.
Yeah. So I keep myself occupied. I keep myself busy, and I try as much as possible not to have any, loophole where my mind will be traveling round, because cancer journey it's um it's a very it's a very disturbing it's a very disturbing journey. And we have different types of we've got different different types of breast cancer. We've got the invasive breast cancer, which is mostly invasive, which has no special feature or class. We've got the invasive lobular cancer, breast cancer, which is the second most common type of cancer, which is also known as invasive lobular carcinoma. We've got the ductal, which is the DCIS, which is the ductal carcinoma in situ. So it's the one that is inverted. And that was the type I had. So we've got the triple negative, which is one of the ones that once you go through your treatment, maybe mastectomy, chemotherapy, radiotherapy, there's no more medication. So that person is forever thinking, is it back? Is it not back? Is it back? Is it not back? So when you have the HER2 positive, which is like the type I had, which is the hormonal receptor one. So what they tend to do is to shut down your hormone at the start of your treatment. So you're not going through, your hormones are all, it disappears. You're not menstruating. There's nothing else happening. The estrogens are all gone. So once they shut that down, you go through your treatment, you come back. Some people come back. I've seen some people who have finished treatment and they continue seeing their period. And with that type of cancer, you end up being on something called tamoxifen, which is a hormonal tablet, or Zolodex and other types of hormonal drugs. So with that, I've been on tamoxifen. This year is 8 years. I've been on tamoxifen 8 years this year. Normally, they will tell you take it between 5 and 10 years. So when I clocked the 5th year, my oncologist said, continue. So obviously, I have 2.5 more years to go by God's special grace. Even if they want me to continue beyond, I don't really care as long as I'm alive. That's the most important thing. And the bottom line is, I say to people, when you're going for your treatment, when you're going to go and see your doctor after your test, please go with somebody. Because sometimes the news might not be pleasant. And at that moment, your thought process, you're going to lose it. You will not be thinking straight. And I say to people, when you're going, even if for people that are going through treatment, go with a notepad. Write out things. When the doctor is talking, write it out. When they finish talking, ask questions. Ask questions, because at the end of the day, it's your journey, it's not their journey. Don't come and be blaming, oh, this doctor is not doing what I said, is not, because you're not asking the questions you need to ask. But there's some women, you ask them, what type of cancer is it? I don't know. What stage is it? I don't know. What grade is it? I don't know. And you're coming to me. You're coming to the wrong person. Because what do you want me to say to you? If you tell me it's stage 2 or stage 1, then I'll say, okay, no problem. Send your this thing. Let me forward it to an oncology doctor that I know that would say, okay, go ahead and do X, Y, Z. What your doctor is saying to you is accurate. Go ahead and do it, So we need to be conscious of our body. We need to understand that we're women, our body changes. Our body changes due to childbearing, menstrual cycle, a lot. And most especially, please avoid stress. Avoid stress. Because when you're dealing with stress, don't forget that your hormones are also playing games. And you don't want that. You do not want that. Let me tell you, this is where I keep men. You see men here on the shoulder. Because some people will come, these people on this group will tell you, some of them that know, they will tell you, I keep men here. especially if you're married, keep them here because let me tell you, no matter how much the man loves you, there's a side chick by the side waiting for you to go because they've called that word cancer. So if the man disturbs you, you're going through treatment and he's giving you stress, just do like this. The person will fall out and face your life. You see women crying, oh, he's not supporting me. I don't want to lose my marriage. You want to die? You die. That woman will be at your funeral. She will come for your funeral and a week later she will move in and tell the man to throw the bed you people were sleeping on together and buy a new one. So at the end of the day, the life should be your life. It's your life. You must enjoy it to the fullest. I say to people, you must enjoy life to the fullest. Stress, take it out. I always say, if you don't have money to go to what they call posh restaurant, there's Mama Ireti by the junction selling bole. Go by there, sit with the woman, drag her small chair, put by your side. Tell her, Mama, abeg, how much be this bole, abeg? Collect the bole. She will tell you it's 15 naira. Okay, wrap 100 naira home for me. Sit there, drag. Mama, you get water. Collect the water. Collect, if it's groundnut, collect it. By the time you eat 200 naira, you're gisting with her, you're laughing with her, you've forgotten your problem, and you go home. When you get home, if you don't have bathtub, it's shower you have. Boil water in kettle, put it in bucket like we used to do in secondary school. Go and shower yourself. Carry powder, rub yourself well. No tie, I'd say don't tie, I don't like women that tie wrapper on their chests. Don't tie wrapper on your chest. Now you can go to markets, buy something like this, chiffon, plain one. Use it and sew, what do you call it? Gown, sleeping gown or whatever they call it. Use it and wrap yourself and be a baby girl in your corner. Why do you want to kill yourself? Why do we want to die because they said it's cancer? When you are not looking after yourself, and again, please, for people that haven't gone through this journey and you're here, please be tenacious in checking yourself. Once, in fact, every day, be pressing, be press the body where. Press it. Is your body, is your body. Press it. And don't only concentrate on the breast, your armpits, underneath the armpit. Check underneath your armpit. Your collarbone. Here, check it very well. Check it very well. Even people that have gone through this journey, me up till now, I still check. Even the side that you've done the mastectomy. Some people come back and say the cancer had come back, and it comes back on that same one that they have removed. So you have to press, you have to check well. Check. If you feel anything, I beg, run, they go. We all want to live. We all want to live. We all want to survive. We all want to see our children. And, let's do the right things that needs to be done. Okay, let me take a few questions then, and I get my breath, then we can continue. Yeah. Ariwa, your hand is up.
Someone else had already raised their hand up before
Okay.
mine. Yeah. So to ask question about those people who they maybe they've had it before, it's gone and the cancer returns. Is there any reason why it does that? Or what can be done or prevent, is there no prevention after it's been treated? What are the things, what are the factors? Why does it come back? Is there any medical thing, associated with it? Or do you get what I mean? Because when they said the cancer comes back aggressively, from what I've heard from stories, news we've heard about people, oh, the person has been cancer free for years, living well, and this cancer now attacked back, it came back aggressively. So why? What are the reasons? Is there anything medically they can do about it, or is there anything associated to that? Please.
So now, I'm going to look at it in two different ways. I'm not a doctor, but I can tell you from uh, I can tell you from the few knowledge I have. Now, for women based in Nigeria, I will start with that. Some of the cancers haven't been fully treated. Reason being, somebody goes to the doctor, um, somebody goes to the doctor and they've been diagnosed and they start treatment. Once they start and they stop, the treatment is not completed. For example, I know so a few people who their treatment wasn't completed because of financial constraints. Now, when they stop, the the likelihood is that that cancer has not been properly the affected area hasn't been properly treated. Now, obviously, when some people get their cancer, like when I was told it was the aggressive one. So if you're told it's the aggressive one, obviously you want the treatment to be in full cycle. You want to complete the treatment. You don't want stop, start, stop, start, stop, start. Because cancer multiplies, the cells multiply. Every one of us, every human being on this planet Earth has a cancer cell. Everybody. It's just when does it mutilate? When does it start to grow one or does it become cancerous? Some people might have seen lumps that they've taken out and is benign. Now, those kind of people that says because they're small microscopic cancer cells that maybe when the treatment is done, some people will just stop at chemotherapy because there's no money for radiotherapy. And when they do that, if maybe they finish that treatment, because some doctors will tell you, we finish the treatment, you can decide to go through radio or not. And don't forget that some of the cells might be hidden. Some of them might lay dormant for months, for years before they start to divide again. And that's when people now come back, is become metastatic. They will tell you they've had a reoccurrence. So some people, one is incomplete, incomplete, incomplete treatment. Some is they've completed it, but maybe some of the cells were not targeted. If, for example, they were targeting just the breast, and that's why I say to women who are going through cancer, if you can afford to do a PET scan, do a PET scan, because that gives you an overview of everything. Do all the necessary tests. Not because they said is not because they said is breast cancer. When you do a PET scan, that would give you an overview of everything, your kidney, your whatever. They will do everything. So that shows you, is there anywhere, any gray areas? Because obviously cancer is a bastard, it's hidden. Sometimes he hides. You don't see it. So again, and that's why I say to women again, you must go to the proper hospital. Not some people go to what they call specialist hospital, where the doctors there are not trained. Where the doctors there are not trained. So, and when they go there, what are they going to get? Half-baked treatment. It was one of our visits to Lasut. My very first visit to Lasut. That was when I heard the word half chemo. I have never heard about it. The nurse there said they give patients half chemo. What is half chemo? So when you're treating somebody, they said they're just giving the person just to survive. And tomorrow the person comes back and maybe go and do CT scan. They tell the person is metastatic to the lungs. And that's why you must ask questions. What type of treatment? That's why I love Olushola Olushola, Shola will ask you questions. Shola will drill the doctor. Shola will drill. So what is this drug for? How many doses am I taking? How is it? Why am I taking it? So what is it going to do for me? So this, we need to, because it's your journey. It's not any other person's journey. So that's why sometimes when people come back and say, oh, it's metastatic. My first question is, did you finish your treatment? There's somebody I'm helping out now. His treatment wasn't completed because of money. And he's a man, breast cancer. The first male cancer that has come out to say is a man. His treatment wasn't finished because of what? Funding. So now the cancer is metastatic to the lungs, to the what? So he has to start from the scratch again. So one of the biggest problems we have, especially back home, is funding. Funding. So that's why sometimes when I go and beg money, apparently, maybe part of why I was even angry or not feeling too happy today was somebody said to me, sent me a message and said, every time you're begging for money, every time you're begging, yeah. Every time if you're not putting out, you're doing this, you're putting out, you're doing GoFundMe. And I said to her, in my mind, I wanted to say to her, I wish you will experience just a bit of cancer so you will understand. I said it in my mind, but I didn't say it out. And I said to her, you saw it on, where did you see it? On my WhatsApp status, Abby? Did I send you anything? No. So all you should have done was read, jump and pass. Don't come to, and I warned, I said, do not. I said, I'm not going to block you, but don't you ever try it again, please. The next time you do it, I'm going to drag you on social media. I'll put your picture everywhere and I will drag you. You won't like it. And for that relationship is gone. You don't come to my page to tell me that kind of thing, especially when we are battling something. I'm still on medication. Have I finished? No. Why would you come out to come and be telling somebody going through cancer that? You don't. You don't. So somebody asked a question. Somebody asked what's the difference between chemotherapy and radiotherapy. Am I right? So
There's a
chemotherapy,
question there.
yeah. So chemotherapy is cancer drugs that is given intravenously via the deep tissues. So and some of them are oral. And what they do is they supposedly kill cancer cells, stop them from growing or dividing. So some of those chemotherapy, when you go, they will tell you you can do you can do it intravenous or you can take the oral one. I know somebody who is on oral chemotherapy. So you can take the oral one and you can take the what do you call it? The intravenous one. But 90% of the time they give people the intravenous as a start. And radiotherapy is a high energy radiation, which is the one we go under the rays, and you're not seeing what is happening. So some people come out and say, "Oh, I'm very tired from radio." Well, we will be tired because they just put you there. After 5 minutes, you come out. You don't know what they've done to you. So it's a ray of light going through your body. So they are targeting the area. They are seeing, when they are looking at it, they are seeing what they want to see and where they are targeting. But we lying on that bed, we don't see anything. So most radiotherapies, I always say to people going through radio to make sure they are very hydrated. And you find out that some people after radio, that part of the body is, I use the word black. It's very dark. It darkens off. So when it darkens off, it will change. Your colors will come back. Your color will come back. If you're dark naturally, it will come back to your original color after that. Yeah. Ira, is there any other question?
There's another question in the chat. Sorry, I was talking on mute. There's a lady that asked, can you, talking of BRCA test, do we have testing centers in Nigeria and what are the cost range?
Okay. Unfortunately, I don't know what if there would be, if as long as there's centers where you can go and do mammograms and all that. With that, I can find out. I can speak to Dr. Molala Salako to find out if they do it. If they do the BRCA test in Pearl Oncology specialist, the hospital, there would be places where you can do it, but with how much it costs, I don't know. Because I say to people, please, if you've got daughters, even if you've got daughters, if you have never had cancer, please get them to start checking. The youngest cancer patient in the UK was 8 years old with breast cancer, and she had to go through mastectomy at 8 years old. She doesn't have breast, but they had to get all that out. So the thing is, as she's growing, obviously only one breast will grow. Then when she gets of age, then they will do a reconstruction for her if she wants it. So if we've got daughters, please let's get them to press check. If they see anything, tell them shout mommy, not uncle. Oh. They shouldn't go to any uncle to check for them.
Wow.
Is there any other question?
Any questions from anyone? Thank you so much. This is an informative session. Very, very informative. And yeah, I wanted to ask you personal questions, how
Yeah.
you felt when you first when they told you, the news, but you've said it during the time you were talking to us, and I wanted to ask you what has helped you to stay stable emotionally and mentally. I wanted to ask that question as well, but you've mentioned it, you get yourself occupied, which is good.
Yeah. I
And you
get
are always
myself.
surrounding yourself with positive minded people.
Yes.
Anything
Yes.
negative, I know you cut it off.
No.
You don't like arguments, you don't like any toxic thing in your environment. I know you that for that, and you've mentioned it as well. Yeah. So I think what other questions have I got penciled down? So can you please you know, I know you have a son and during the time you were in the hospital, I don't know how long you stayed for in the hospital and all that. How did he cope? You know,
Okay.
how did he handle the situation? Do you get what I mean?
Yeah.
Yeah, please, I
So
would like to know.
when I was diagnosed, I didn't tell my son because that was when he was getting ready to go into secondary school. So he was doing was how yeah, he was getting ready to go into secondary school. So they were doing that, the SATs. So I didn't want to destabilize him so he could do his exam. But I didn't say anything to him. The day he found out, he cried like he has never cried before. So I was when so by then I'd started treatment. I didn't tell him what it was. But somebody came to buy, I was still doing my cooking, catering, and somebody ordered food. The person came to pick the food. So I was now telling the person, oh, that this is what is happening. Oh. And my son was upstairs and immediately he ran downstairs.
Did
Hold
you
on.
do that on purpose? Because you knew he was upstairs. Or you thought he was doing at home or maybe he was sleeping?
No, I knew he was upstairs, but I didn't know my voice was actually loud for him to hear.
Yeah, okay.
So when he heard it, he came down and said, I knew it. I knew because I've seen people with cancer, their hair is falling off, and now your hair has all gone. So, mom, why didn't you tell me? I said to him, I apologized, and I said, listen, you were taking an exam, and I didn't want to. If I told you I didn't know how you handle it, it might not be secondary school now. You might not have gotten the school you wanted and all that. So he hugged me and said, don't worry, nothing will happen to you. I said, nothing is going to happen. Don't worry, we're in it. And he said, we're in it together. So during one of my process of doing my treatment, I had a blood clot on that nearly killed me, and they had to stop the chemotherapy. And I started taking the thinning injection. So my son came up to me and said, "Oh, mom, what's that you're taking?" I said, "To thin the blood thin." He said, "Okay, can we do it in turns? You give yourself today, tomorrow I'll give you." And that's what we were doing. So I give myself today, tomorrow, the next day he will come and do the injection himself. And that kind of now gave him, he said, maybe I would like to go into the medical side. And that's when he now decided he wants to be a physiotherapist. He wants to do
Mm.
physio. So even then, I had to, when I finished, I was doing physio. He would see me. He said, okay, just sit. He will go on the internet, get exercises for me to do and all that. So
Oh.
it was, it was, it was, it was a very good healing process for me because he didn't throw him off that too much, but he was able to handle it.
Mm.
Yeah.
Wow. Wow, wow, wow. Thank you for sharing that. Does anyone have any questions? Please comment. Right. Um, so wanted to ask you, sorry, I'm the only one asking questions about your I know obviously your journey, overcoming cancer. I always call you, you're more than a conqueror, you've conquered it all by God's grace. And this has helped you to birth your mission, your vision to empower other women and to support them. Because I know you do a lot in Nigeria. So well done for that. So maybe you can talk to us about, the good work you've done in Nigeria and what you intend to do this year, because I know you're moving differently this year. There's another event coming up in October, which you've not done before. Well done for that. We're cheering you on and we're proud of you. If you can tell us, give us more insight, what inspired you to move into that direction and what should people should be expecting in October and how we can get involved. Thank you.
Thank you. So, yeah, I think 3 years ago when we did, or 4 years ago actually, when well, 5 years ago we started off, but 4 years ago we did our first gathering with women. So we had this little bubble of women, the group. And after so I met Olushola. How did I even meet Shola? I think I met Shola online. And since then we've become family. And when I met Shola, normally I go through her to ask questions about things happening in Nigeria. How is this happening? How is that happening? And so when we did the first what do you call it? When we did our first event, which we had in Lagos, we had this little group. So we didn't dissolve, at the end of the day, we didn't dissolve the WhatsApp group. So we kept it. Then when we kept it, we thought, okay, we'll just be doing things little by little, little by little. So last year, I think the name Giggles and Grace dropped in my spirit. And I thought, okay, what are we going to, since these women, we don't want to dissolve the WhatsApp group, what do we call ourselves? And that name, Giggles and Grace, dropped. So it's just a community of women. We come together to have fun. It's a family. Nobody's taxing anybody. Nobody's asking anybody for money. Nobody's coming to post anything. Is a well-controlled platform. So what we do is if we have events, we post it out there, we say what we want. So we do different things every year. So this year, I don't know if she will want me to mention her name, but I'll keep it. I won't mention her name, but during the event, I'll have to unveil who she is. So one of the survivors came up to me and said, Ruchi Messi, we will come to you. I see your hand up. We'll come to you. And she said to me, Ma, there's something God has given me two things, and I've prayed about it, and I've had this. Is the burning desire. I've had it. I've had a good conviction about this, and I see a beautiful women coming out. People who have gone through cancer. It was a beautiful place. Da 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 da. And we talked about it, and I said, okay. I took it back. I went to pray about it. And I think 2 days after I came back to her, and I said, we will do it. I know it's going to be financially consuming, but we will do it. And one thing I've done in the past is I've tried it. If I don't get the go ahead, the money is not going to come. Even if I beg for money from even the people that normally give, that normally support, they will not answer you. But when I put it out there, we've had good responses. We started looking for venue, talking to people. And the moment we secured the venue, I knew God's hand was in it. So this is the first ever in Nigeria, breast cancer survivors fashion runway that will be happening on the 9th of October, 2026 in Lagos. We are preparing for it. So that's one of the events we're having because we need to start for me, I think of life after cancer, not while we're going through it. So what I try to do is to get women to start thinking, you know what, I'm going through this, but I'm surviving it. Life has to go on. Even if you're still going through treatment, you still have to come out, show yourself that you're resilient, you're strong, you're beautiful, that you can do it. So we're doing the fashion runway on the 9th of October in Lagos. And as part of that, every year we also do medical outreach, and we're deviating a little bit from what we do. And this was a clear instruction I got from God through somebody, because I would say is a confirmation. So somebody, a friend, a classmate of mine, and he's an Hausa man, a Muslim, that called me and said, why don't you do things differently this year? And I thought, what do you want me to do? And he goes, I need you to, why don't you, instead of giving people, what do you do? I explained what we do at the medical outreach. He said, okay, instead of giving cooked food and raw food, why don't you scrap one and give medical and fund the medical health insurance for people? He said 200. When I calculated the figure and I calculated my salary, I said, Oga, this thing you're telling me, it won't be possible. He said, I know you can do it. I know you can do it. Go ahead. I said, okay, give me days. Let me think about it. When I thought about it, I got a conviction for 100. And I said, if I get the money for 100, then we can, obviously it's in December, we can increase. But for now, let me go with what I have confirmation. So so the two major events we're doing is the runway in October and the medical outreach in December. So, and as a result of that, I've got three beautiful ladies who said they said the only way they can support is to send in their pictures and we do a GoFundMe for it. And they've been vulnerable with the pictures they've sent. They've come bare chest. They've shown, yeah, they've come very vulnerable. They're not wearing anything on top. So you could see the scars. And three ladies from the Giggles and Grace. And so we've done the GoFundMe account, and I've started spreading it around. Whatever we raise from it would go towards the October event. Yeah. Yeah.
Wow, wow, wow. Amazing. Well done, beautiful woman. This is so inspiring. Ah, ah, amazing. Thank you so much. Yeah. We know about the event. We'll keep spreading the word, and obviously we'll be supporting. Her Connector will be supporting as always. And I think there's a question in the chat before you attend to the lovely lady that raised her hand up.
Okay.
So the question is, there's some comments which I have to, someone said, wow. Someone said, okay, Busayo Adeba just said, new dream was birthed through a difficult situation. Absolutely. And another one from Ruchi Mercy. Thank you, ma'am, for everything. You are a Triver. Absolutely. Yes, she is. And the question is from Busola from Busola, yes, from Busola. Sorry, I don't want to pronounce the name wrongly. Is it in all cases of fung, fungated breast that the cancer has metastasis? Also can, sorry, you have to read this yourself.
Okay. Is it
I
in
don't
all
know all
cases
those
that
strong
fungated
words.
breast that cancer has metastasis? Yes.
Okay.
Once the breast is fungated,
Metasized. Oh
yeah,
yeah. Okay.
yeah.
Sized.
Once
Okay.
once the breast is fungated, the percentage that is metastatic is very high. So it might have gone to the nearby organs.
Hmm.
Because for a breast to be fungated, when if you understand what fungating
Can
is,
I ask a question? Yes, I don't know. That's what I wanted to ask.
fungating is when the breast is rotten.
Jesus.
So fungating is just it is just a nice name to call it. When a
Hmm.
breast is rotten, when you see an orange, you know the way our orange is, and is
Oh.
completely rotten.
Hmm.
That is what a fungated breast is. So, because they're not going to what they will be treating at the moment will be to dry up the breast. Because if a breast is fungated, they can't operate on it because there's nowhere to put the knife. There's no skin layer because it's rotten. So there's nowhere so what they do is they would try to dry the place up. And obviously it takes time. So you don't allow your breast to be fungated before you go to the doctor. And can metastasis happen even without recurrence? Yes. Yeah, it can. It can. Because some of the cancers are already stage 4. Some people are stage 3. And don't forget that stage 3 has categories as well. Because you might have a stage 3 that is that is stage 3B, stage 3C, that is stage that is nearly going into what do you call it? Nearly going into stage 4. So that's why it's always very important that we all are conversant of what is happening to our body. Yeah.
Thank you so much for that. There's a comment here. Um, said, beautiful you, mama, for reoccurring stress is a factor people silence.
Yeah.
A lot of us ill and go back to old ways. Food, lifestyle can be the old way ever again. And in all, live the moment, no manner of it all.
Yeah.
Absolutely.
So
Thank
in
you so
terms,
much for that.
let me just stress in terms of food, because people come out and say, what can I eat? What can't I eat? What can I eat? They say you can't eat this, eat shop, eat this. Please, we've had this conversation before and again and again. And on the 2nd of August, we have an oncology doctor who will be coming up to speak to women, have to speak to women on anything, everything cancer. So prepare your questions. But I can say to you, you can eat anything.
Invite us in our community as
I
well.
will, I will, I will let you know. You can eat anything and everything, but in moderation. Now, anything and everything. We had Dr. Wenga Saka. He's an oncologist in the UK. And when we had this event, people were asking, what can we eat? He even said, I think it's people from Ondo State that have the best pounded yam. He said, please eat your pounded yam, but eat in moderation.
Moderation.
Yes, everything is in moderation. The
Moderation,
only
yes.
thing that there's nothing anybody will tell you, is it clinically proven? If it is, let them signpost you to where it has been clinically proven. Then the other thing is, if you're on the big side like me, try as much as possible to be, what do you call it? To be to not to sit in one place, be agile, take some walk. Instead of you want to go somewhere, you're entering keke, walk halfway and jump the keke the remaining way. I go from my house halfway and before I jump the bus. I don't drive before I jump the bus. So keep active. You need to be active, because weight is another factor, is one of the factors that they tell us that is not good for cancer. So we need to be conversant of that. Then some people will say, oh, they told me you can't drink malt. You can't drink. If you drink one bottle of malt in one bottle in 1 year, that's not what that's not what is causing cancer. Please, let's be realistic. If you can avoid it, please avoid it. But if you want to drink malt, you as soon as see me, I drink malt, I take alcohol. My alcohol might be one teeny thing a little in this thing, just a little. I'm not an alcohol person, but if I go out, I might sip one or two, Baileys. Yes, I take Baileys too. I do take Baileys. In fact, I have a bottle. I pour it, put ice, I drink it. But it's not something I indulge every day. So it's something when you indulge every day that you will be thinking about, oh, should I? No. If you in Nigeria, you can walk. Carry your leg from one point to another point before you enter your car or jump bike or get the bus or anything. You know? Yeah.
Thank you. So, can you attend to
Ruchi,
Ruchi Mercy
yeah,
before? Yes.
Ruchi, can you put your video, because I wanted her to share a bit of from people that are not going through cancer, they possibly would understand the kind of things cancer survivors go through financially. What's her name? Well, she's Ruchi on this thing. Can you unmute yourself? Yeah.
Um, Good evening, all.
Good evening.
Okay, I will just say a little bit of my story. For people that are not in Nigeria, the way they approach cancer treatment is quite different from us here in Nigeria. Like now, maybe your GP has people following up on you, but here it's not really done like that. Let me start with how I got to know about my cancer. Okay, I started seeing something like a dimple, red spot on my breast. So in my head, I was like, does pimple happen to the breast? Like, does it happen on the breast? Then I started noticing a lump after that. I went to see a radiologist, and they said it was a fibroadenoma. there is nothing to worry about. But because it's not on the other breast, I wasn't convinced. So, and that period I was preparing for my NYSC, I started noticing that I started having weight loss. I started having acne on my face, my chest, my back. It was getting so bad. I met one of my friend that is a nurse. She said it's hormonal imbalance that gradually it will correct. But I wasn't satisfied. I still went to my NYSC. While in the camp, I found out that as in core members were covered by the NHIS. So because of all those things happening to me, I had to list up to 15 things that I checked, including blood culture, breast scan again. Funny enough, when I did the breast scan, there were like five, well, I don't know if the student knows, but there were five people there. They were, checking that breast. And what the head of those people told me was, is nothing to worry about, that my breast was growing. I told him, how can my breast be growing at the age of 30? That there is liquid coming out if I press this breast hard. They were like, except I'm looking for anything, that there is nothing to worry about. Because I wasn't a doctor, I ignored it. And for 1 year, within the period of that 1 year, I added a little weight. Those acnes were coming and going. They were not like permanent. Then I'll wake up in the morning, that same breast that had that pimple, the pimple has gone, but that breast was heavy. I was thinking, okay, they said your breasts are not usually the same size, so probably it's just normal. Until I start falling sick, I'll be falling sick, I'll be treating malaria up and down. It wasn't getting better. Then the next thing, I started noticing that my nipple started retracting inside. I started seeing this orange shape, like having dots on it and everything. And then I now started feeling sick. Now, the lump on the breast was no longer moving. It was very hard, like when you knock on the wall. That was the sound I usually feel when I knock on my breast. I now had to go and see a surgeon. They booked me to do a leptotomy. When the surgeon came, he checked my breast, was like, it's not possible. You can't remove the lump because it has passed half of your breast. Like my whole breast was, because I have a very small breast, the whole breast was just filled with that hard lump. So they said they have to do a biopsy. So it was during the biopsy, I think the anesthesia they gave me, I could feel the pain that I started shouting. It's paining me. So they only cut some part of it. And after 2 weeks, the results came. It wasn't the doctor that told me that my results. I was the one that used my phone and browsed what the result was, because my sister had to go and pick it. When the results came, I was making my hair. So I told her to help me pick the results. She didn't tell me the discussion the nurse told her. It was later, after I was done with my chemotherapy, that she told me that the nurse told her that it was a 50-50, that I may not make it. So when I got that result, I browsed. What I saw was invasive ductal carcinoma. That was breast cancer. Then they've not done IHC. I had to reach out to my alma mater because I went to Federal Government Girls College, Owerri. So I met my set.
Did you
They
go to
told me,
FGGC or where?
yes.
Okay, we'll talk later.
Okay, so my set, 09 sets, told me, Mercy, one of us mother had this cancer and they treated her in National Hospital. Come, let us check National Hospital. I told them, to be sincere, I don't have it, because that was just 5 months I left my NYSC that I was diagnosed. I'm not still working. There was no money in my account. I was still trying to figure out how I was going to start life and everything. And then this one came. I just took a small bag and I came to Abuja to do that second opinion. And after everything they checked, even when they did the first biopsy, they said they have to do a further testing. I started asking, why further testing? The man was like, he was even harsh. He said, for something to go for further testing, that means it's not good. That was how he answered me. So my plan of staying 1 week in Abuja turned to 2 months. Thank God my friend that accommodated me was kind enough to keep me in her house. Then finally the result now came out. It was cancerous. I was sent to the oncology, and in the paper they gave me, they wrote neoadjuvant chemotherapy. And then I was now told about the Cancer Health Fund, because while I even agreed to come to Abuja was because I browsed about, okay, how cancer survivors or patients get support. And I found out there was something called Cancer Health Fund, funded by the government in 6 geopolitical zones. Abuja was one of them. So that was why I said, okay, let me go to Abuja in case. That means I can get support using that Cancer Health Fund. So while I was filling the form, I got to where they wrote stage, and the doctor told me I should put stage 4. I was like, how? Because I've already done my CT scan, abdominal pelvic. I checked. I know I browsed about chemo, and chemo stage 4 shows that you'll be like a vegetable. You will not be walking around. I was like, I've been the one walking around on my own, and there's no sore. Like, you understand? It's only the only thing that you see that I slimmed down. She told me it was stage 4. Then my class girl asked me, do I want to go back to the east or do I want to stay back in Abuja? I was like, since people know some people here, let me stay here. That was how I now started supporting from house to house to be able to do this treatment. And then they were like, they should give us a list of what you need for this chemotherapy journey. And then they gave me a bill of 6.5 million. To be sincere, as in, I melted at the car park because you're giving me 6.5 million while I don't even have up to 10,000 in my account. The only thing I did was I knelt down at the park. That I can remember. I knelt down and I raised that paper. I was like, God, if this is what you want me to go through, then provide the funds that was and go through this journey. That was the only thing I said, and I prayed. I called my class girl that was the one reaching out. She was like, Mercy, the money is plenty, but let's see how it goes. After they now had to now open up, because before it was anonymous in the class platform, they now opened up, everyone was shouting, Jesus, what can we do? This one, that one. And then the flyer was done. It was very hard because my family church, we don't take medicine. I attend faith. So it was hard coming out to come and ask for funds when your doctrine doesn't support you taking drugs. I just had to tell my parents, now we are talking about my life. And besides, I'm not even a baptized member yet. So I can actually excuse myself and fight for my life. I know so many calls came in that period. God was so faithful because in the university, I was the director of treasury, plus other positions I've had. So most of them started reaching out. Is this scam? Is this true? And God was merciful. That money was raised within 1 week before I started my chemo. But now the doctor didn't tell me that I will have to take targeted therapy. They only put chemotherapy, surgery, and radiotherapy. I did 8 cycles of chemo using that money. From there, I also feed because I was not working. Then after 8 cycles of chemo, that was in May 2024, I now went back to her asking her about surgery and radiotherapy. That was when she now told me, Mercy, you are stage 4. They don't do surgery on stage 4. We are going to place you on targeted therapy. And each cycle of this targeted therapy is 1.2 million. We're like, where am I going to get that kind of money? The people that donated money, we told them we're going to do surgery with the therapy, and my hair has already started growing. So how do I go back and tell these people that now they changed my medication? That was when the Cancer Health Fund came to play. The Cancer Health Fund funded this targeted therapy, 10 cycles. And since July 2024, the government has not given money again. And I've made inquiries. More than 200 cancer patients are on the queue. The funny thing is that what kills most cancer patients here in Nigeria is the financial toxicity. If you're telling somebody not to go to herbs, how do they continue their treatment? Common to do biopsy. Most people don't have the money. So there's a lot of things that needs to be addressed here in Nigeria because the people that are leading us up there, they're not cancer patients. They don't understand what we are going through. And then talking about the doctors, I on my own, before I started my treatment, I had to make inquiries of what I should prepare my mind for because these doctors are not cancer patients. So the only way I helped myself, because I did not even know anybody when I started my chemo until I finished my 8 cycles of chemo. The only thing I used to helping myself was when they gave me my drugs, I go back and I sit and I check which food works well with these drugs. That was how I took my 8 chemo and they did not change my drugs. Even now that I'm taking my targeted therapy, I don't eat everything. So in that aspect where Madam Collier said, eat everything, for me, I don't eat everything because I believe someone that has triple negative cancer and hormonal Beptos cancer, there are things someone that has hormones will take and someone that has triple negative will take, it will not work for them. Like now, shower shop foods, I was craving for it and I went to the market and I got it. But before I wanted to eat it, something came to my mind. Mesty, check if this thing works with your Ibrance, because that Ibrance is 21 tablets, 900,000. I won't, because of a craving, spoil a drug that is very costly and I can't even afford. And I checked. It happened that my targeted therapy is my liver enzymes that breaks it down for me to be able to, for the drugs to work, and then it can leave my body. But soursop foods is going to block my liver enzymes. Imagine that I took this soursop and took my Ibrance. That means the drug is not going to work and it's not going to leave my system. And then the side effect of that drug is low blood count. That means I'm going to keep suffering from that low blood count until it finally leaves my system. So that's why some cancer survivors should be very careful what they eat, especially when you're on that particular medication. For me, what I did during chemo, any other thing, supplement or whatever, during my chemo, I don't take it. I only allow that drug to work for 1 week. Then the second week, I can now start taking things to build my blood. Then the third week, then preparing myself for my chemo. So currently now, you have to know how your body works. When my blood is low, my gums start paining me. Because before I got to know about this targeted therapy, the first time, I started feeling dizzy. I was like, it has not happened to me like this before. That's being self-aware. You have to know your body very well. I had to now go and check. And I checked my white blood cell was 1.3.
Mercy, please start to round up.
Okay, yeah, it was 1.3. So now that helped me to know what I should take and what not to take and how to build my blood. Since I started taking my chemo, I've not taken blood transfusion because I go for those vegetables that will help me build my blood. So as cancer survivors, patients, we have our own role to play, while the doctors have their own role to play. And also, I encourage all cancer survivors. I know it's not easy coming out to speak because of stigma, but one person cannot fight the fight that every cancer survivors will benefit from. We have to have our own platform, use our platform and talk. This, by the time more than 2, 3 people, 4, 10 start talking, everybody will know that this thing is a serious case. I'll end here. Thank you very much.
Thank you so much, Mercy. Thank you for being vulnerable with us. Thank you for sharing your story, your journey. In fact, I was speechless. So many things were running through my mind. I can only just imagine. But thank you for sharing with us. And I'll speak with Kolia. We'll get back to you. Thank you so much once again for sharing. What's that state? It's so disheartening that they could leave you for years, I think for like 2 years before they could tell you it's actually breast cancer you have. But I've got a question, Collier. I know we've
Yeah,
really, it's almost 9 o'clock. We'll be rounding up now.
yeah.
Thanks for everyone for your patience and for sticking with us till this time. So my question is, you know, there's lump, there's one you said rashes and all that. Is it all breast cancer that comes with lump, or some don't come with lump at all?
Some don't come with lump, and those are the dangerous ones. Because why I say it's dangerous is because you might not notice it on time. And that's why it's very important that we check out when you're showering. For everybody that shower every day, I take it that we all shower every day. When you're showering, look. If your nipple, never had inverted nipple, and you notice that maybe is inverted a little bit, just go and see your doctor. Don't start guessing. Don't guess anything. You're not the doctor. You're not the specialist. So then rashes, like she said, you might see rashes and you might think, if you look at it and maybe 2, 3 days is still there, please go and see the doctor. Let them look at it. They might tell you it's nothing. But obviously, when they tell you if you take your full course of antibiotics and it doesn't work, then you have to come back. Treat it like that. Go back. Now,
Mm.
somebody said has came with heartburn. It can come with
Mm.
anything, anything. So the luckiest ones are the people that feel the lump.
Mm.
But again, you might feel a lump and you ignore it. It goes to the lymph nodes. So once the lymph nodes is affected, that's also a problem. because from the lymph node it can travel to the kidney, it can travel to the because the lymph node is what transports blood and water. It's so that's why the first thing they check is, once they check his breast, they check your lymph node to make sure that there's no affected lymph nodes. So like when I went through mine, I know the first thing they did was, after they did the biopsy and everything, and it was cancerous, the first surgery I did was to try the lymph node. So I did that I got the diagnosis in May, did lymph node surgery in June, did mastectomy in July. So they had to take the lymph node. So when they took the lymph node, they said one was affected. So I had to sign a paper. I said to the doctor said, oh, when they're doing the surgery, if they will have to test the lymph node again, just to make sure that nothing has spread. So when they did it, and I signed, they said, how many lymph nodes would you want us to take? I said, if you can take out everything, take it out. But they said, obviously, if they take out everything, I'm going to be suffering from lymphedema and all that. So when my surgery was done, they out from that side, they took 26 lymph nodes out. So it's important that when you see anything, don't second guess. We're not doctors, you know. We're not doctors. Let's treat it as such.
Thank you so much. Like I said, I didn't know the session would be this long. I told you, I said, this is not the only session we'll be having, that we're going to have another session. I've got many questions, but I think I'm not going to ask tonight. I think I'm going to put them together, summarize them. And during the next session, maybe those are the questions I'm going to ask first.
Okay.
And now we've talked about it. It's actually the hard truth. You know, sometimes in your head, you'll be thinking, oh, I've got pain, or sometimes, oh, I'm fine. I've got this, oh, someone discussed with me that this. You've been looking at stories and all that. As you were speaking with me, I remember, was it last week or 2 weeks ago? I came across a woman on a platform. It was difficult for me watching that video. I actually wanted to send it to you and one other lady, but I just said, no, I'm not going to feed into things like this and send this. It was terrible. It was a very massive, the breast was so massive, looks like a rock with so many. Just don't let me talk about it on it. It was terrible and couldn't even watch the video. I had to quickly scroll, and I had to start taking my mind out of it. So I would say stories like this, platforms like this, make you want to think really deeply. First and foremost, thank God, for being alive, for being healthy. And secondly, reminded us of not to ignore any signs in our body, to take our health serious. Most women, I say it again, most people, even men, because I think, was it two, three, I'm not sure if I mentioned to you, my cousin, we didn't talk for a while. So when we got talking recently, and I was just, we're trying to sort things out. And she said to me, she said, just be thankful my husband is alive. He had cancer. I couldn't believe it. I screamed. Is of course, prostate cancer. And they visited, they shared the journey with me, which was really, really very informative. And I had to jump on my family's group and told my brothers, please, please, please go and do this and do that. This thing affected this person, and these are the steps they've taken. Early detection is really very important. We shouldn't take our health for granted at all. Many people, we do hair, makeup, clothes, and all that. No, the body we're decorating should come first. This is really, really an eye opener. The information I've gotten here, the insights, in fact, thank you. Thank you so much, all, most especially Collier and Rachel Mercy, for being vulnerable, for sharing your journey with us, for using your experience, to educate us. Thank you. That's all I can say. And definitely we're going to have another session. We need to know, I think it's going to be like 30 minutes Q&A. People are just going to drop their questions. Then secondly, maybe life after cancer. Then another one, it's please kindly invite us to the one you're going to have with the oncologist. And if possible, after that session, we can invite the oncologist to our platform to come and educate the women in our platform. So thank you so much once again. And we would like to extend our thanks to the women, lovely women in your community that joined. Thank you for your time, for joining us. And I pray God will continue to be with each and every one of you. The people
Amen.
that have survived, affliction shall never rise again in the mighty name of Jesus.
Amen.
Yeah, we
Amen.
just need to be there for each other, show each other love, kind words, no negativity. And please take care of yourself and check in with other people around you. Show people love and kindness. People are going through things, hard stuff everywhere in the world, but most especially Nigeria. Yes, my heart bleeds for my
Yeah,
country.
it does. It does.
Yeah,
Thank you so much, Ariwa, for the time with
yeah.
everyone
Thank you.
here.
Yeah,
And I say Happy Survivors Day to every survivor who is here. And always
yeah.
remember that cancer is not a death sentence. Don't
It's
allow
not.
another person's story to discourage you or
Mm-hmm,
somebody
mm-hmm.
who's passed on. Like I always say to Ariwa, we need to sit down and ask God, what is long life in your dictionary, in your books for me? Because what God might tag as long life for you might not be what you are thinking is long life for you. In as much as, yes, we all want to live, some people don't even want to die, but we're still going to die, and at some point we would go. And that's why I say to people, be prepared at all time, not at some time. Don't say, this cancer. If people, you can't come to me with any negative. When you say my cancer, who gave it to you? How is it your property? It's not. It's not your cancer. And when you people know, when I talk about, I say the cancer. So let's just know that we're survivors, because from the start of diagnosis, you become a survivor, regardless of whether you're still in treatment or you finish treatment or anything. So we just want to say thank you to the Connect Hub and to Arewa for this privilege to be able to share our story and also encourage ourselves in, cancer is a dreadful disease. That's all I can say. But hey, we're still standing. If somebody told me that, look at the hair, how many years? This is
Yeah.
this is 3 years of growing this hair, and look at it. But when I was doing treatment, there was no hair. So
Hmm.
why would I say I don't want to go through chemo because my hair will fall out? Now I want to cut the hair. They don't want me to cut the hair. So you
Don't
can
cut the
imagine.
hair. It's beautiful. Yeah, we need to have another set. And it's so, well, should I say it's coincidental that, is this coincidence that we're having
I
this
know.
session on
Yeah.
this today and we didn't even plan it.
Yes,
And I
yes.
even get in touch with you. I was just, because it's been a bit, I was really busy myself, and I'm sure you know that. Cynthia just said, oh, Madam Collier is available today. I was like, okay, let's do it. So we'll be
Yeah.
having more of this session. Thank you so much.
No
And
problem.
we will be supporting you in our home best possible way we
Thank,
can,
thank you very
as a
much.
community. So thank
Thank
you everyone for
So,
joining.
ladies,
Thank you.
please, if you can put your video on so we can see your lovely faces. I want to take picture.
Absolutely.
Just take a picture of everybody that attended. We're survivors. We shouldn't be
Yeah.
hiding our faces. So please, if you can, turn your video on. Olushola, I want to see your face.
We will
Tutu
be
Ade
having
Tutu. I
there's
want
another
to.
lovely woman here that will be she's all about healthy lifestyle as well, Maria. She's going to be
Okay,
having a session with us as well.
okay.
Yeah, I think next, yeah, very
See my
soon.
beautiful ladies. Omolara, turn your video on. Quick, 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 quick. Don't waste my time. People are wasting my time. See them, see fine girls. See them. If you're in the dark, if you don't have light, go and bring torch. I want to see your faces. I want to see your faces. See fine girls. Happy Survivors Day. God bless you all. See my Shirley B. God bless all of you. God bless you. God bless you. God bless you.
Amen.
You people say a big thank you to my boss, to Arewa. You people say thank you because she's giving us this platform to come out to, share our story, encourage each other. And I know by now, most of us are encouraged.
Thank you, ma'am.
Yeah.
Thank you so much, ma.
So I want to give a giggles and grace
Thank you for
love
coming.
emoji. Give her the giggles and grace
Thank
love
you,
emoji.
thank you.
Thank you so much, ma. Thank you.
Give all the giggles and grace love emoji to Arewa, please. Our host. Our host, give her the love. Because she's supporting us for October. You people better, if not, you won't see rice to eat that day. Onyinye, this is your face. Who are you fighting with? Are you fighting with your husband?
Mama, that one is certain. You will never let us down. Rice is sure. Onyinye, you're muted. So thank you, everyone. And I guess we're done for today.
Bye-bye.